So we're going to go ahead. All right, perfect. And then just one final reminder before we get going, if you have just come on, please make sure we get your first and last name in the chat so we know that you're here. All right, and I will pass it to Caitlin.
Great. Thank you. And thanks again, everyone, for joining us on this lovely Wednesday morning. We are really excited to be here with all of you. And I have a slide here that just gives a little bit of background. So as you may be aware, the rules that we're going to be talking about, the rewrite started through the Red Tape Relief Initiative. And the purpose of that was to expand access to affordable, high quality childcare for Montana families. And in this process, DPHHS engaged with many stakeholders all across the state to better understand both the strengths and opportunities and challenges that existed with the current licensing system. And through that process that started in 2022, the agency collected childcare assessments with input from more than 700 childcare facility owners and staff, as well as parents, employers, and state and local agency partners, as well as policymakers and other interested parties through a variety of different methods, ranging from surveys to interviews, focus groups, and even site visits. And so we wanted just to highlight a few of the areas that the relief initiative aimed to target. I also have my little 4-month-old here with me too, so you might hear a little chatter here in the background, but the hope was to really focus in on how the current rule could be improved through how it's organized. So it really focused on how it could be organized by provider type and looking for opportunities to reduce any redundancies and help to just clean up the language that had been kind of piecemeal together over time with the different variations that were coming into play through different rule change processes through the policymaking process. And then there were also many detailed sub-rules that were removed with the goal of, again, helping just to clarify the intent, but leading it more through a pathway of seeing how each of the different types of facility types could access the rules and navigate the rules. And then it was really intended to help propose a new set of rules that was organized by topics. And so each of the rules could state the different types of providers and who it applied to. So the intent was really to help clarify, to help create more of a pathways for different types of roles and to just refresh this rule package that had been in need of doing so for quite a while. I'll pass it back to Angie.
Some highlights of the proposed rule package. If you have had a chance to look at all of that, you will know that it's a very extensive rule package, and we will go ahead and drop that link for the entire rule package in the chat for you to look over. But just some big highlights that have come out of the rule package or that are in the proposed rule package. The first one is some language around teacher qualifications. It's proposed that to be changed to include 16 years of age. Another highlight is that the licensing path has been added for school age care providers and for drop-in care. And what that would mean is it would open up access for those programs to receive subsidies, to receive other things by being licensed. Also, it would help improve quality because they would be able to participate in that program as well. The other thing that the proposed rule package does is it does streamline a multitude of licensing rules to match that past legislative statutes. And we're talking about legislative statutes dating back to 2021. And like Caitlin mentioned, the licensing rules have now been organized by topic, so it'll make it a little bit clearer and easier to navigate. The other thing about this proposed rule package is that any of those legislative statutes, any of those enforcement memos that licensors have been operating on, if this proposed rule package were to go through, this would kind of put all of that in one place within the rules. This would also lead to probably some less duplication. And then lastly, the overall number and type of requirements are scaled down to the size of the provider. So if you're a relative care or an FFN and you're registered as license exempt, then they would have the smallest set of core requirements. And then there's a little bit more differentiation between family and group child care providers. They would have different requirements based on the size of their program. And I will pass it over to Jody. Oh, Jody, I think you're still muted.
I was just going to do that whole, hopefully everyone could read my lips. So hold on here. All right. I'm good now, yeah? Sailing. Yeah, so a little bit of background. Caitlin touched on this, and actually I'm going to throw a link in the chat here myself because everyone else is doing it. So really, this whole process got started in part from the Red Tape Relief Initiative and really from feedback from the field. So we started on something called the Child Care Licensing Project, the department did, and that's the link I just put in there. It gives you, it goes to our website and gives you kind of everything that we've been doing for this and kind of our thinking and how we gathered input from, as Caitlin said, over 700 providers, families, other agencies that we work with to get their feedback to guide this. So that information was reviewed and analyzed, and it guided the child care licensing program in developing this rules package. So that work goes back to, we started that in 2021. The child care licensing assessment came out in 2022, and that assessment itself is on that link I just put in the chat there. So we attempted to take that first kind of run at these rules as Angie and Caitlin kind of gave you that quick overview there of what that looked like back in November of 2022. So if you want to look this up, if you look up MAR 37-1020, it's still out there. You can look at it. And this went before the Children, Families, Health and Human Services Interim Committee. They issued an informal objection. There's some things they didn't like about it. And what that does, that informal objection process puts a 6-month hold on the rules package. So while we continued to take public comment, there was no public hearing as we had scheduled that sort of pushed that back. That first rule package attempt officially sunset in April of 2023, in which case we took some feedback from a variety of stakeholders, incorporated those changes where we could. Some things are federally mandated, and we put it through a second filing. So that's, I think we put a link in there for notice 37-1044. That was published by the Secretary of State on October 20th of 2023, so this past October. And then in November of 2023, the Children, Families, Health and Human Services Interim Committee issued another formal objection. So put that on hold for another 6 months where we can't enact those rules. So for you providers out there or anybody who really works with childcare, you might know that there's some discrepancy between what was passed in the 21 and 23 legislative sessions and what is currently in ARM. So that's what we're trying to update, are those programmatic rules. We did take public comment again, but there was no public hearing for the same reasons as before, as this was objected to. So on January 18th of this year, 2024, the committee met again, and they requested an economic impact statement from DPHHS. So we'll talk about that in just a little bit. They're going to meet again on March 12th. And if you're interested in listening to that meeting, you can find info on the leg.mt.gov page. And you're looking for the interim Children, Families, Health and Human Services Committee. So we get down here. So we're going to talk a little bit about the survey itself. So part of developing that economic impact study that the interim committee requested from us is we now going to you folks in the field and asking for your input on this. So thank you, Caitlin. Just put that in the chat there, links to that survey. So I wanted to walk through kind of what that survey looks like. Oh yeah, so thank you. Yeah, the survey must be completed no later than March 11th, so really just a few more days by midnight. We really want as many people to respond to that as possible. So I want to just kind of walk you through the layout of the survey just to orient you a bit as we're doing that. So the survey is laid out exactly like the new proposed rule. So as you're doing the survey, if you want to reference that notice with the rule, you can kind of go down it and answer those questions. So it starts off with kind of a general. There's a lot of your definitions in there, and it goes into program activities. And it talks about the administration of programs, safety, medical health, the environmental health, nutrition and food, immunizations, staff qualifications, background checks, and then finally that final piece is enforcement. That is, what does the department do if certain things aren't met, if deficiencies are discovered? So that is really kind of how it's laid out. And what we're asking for you to do is think about what would these potential changes in the rule, what would be the financial impact of that on your program as you administer your program. So there's a couple of options in the survey. You can say it could save you money, you could say it'd be no change, or you could say you think this might cost your program more money. There's also areas for open-ended answers. So if you want to supply more information about a particular section, that would be incredibly helpful for us. And then there's a kind of an area at the end for a catch-all. So anything else you want to share about the rules with us. We're really looking for that fiscal impact, but if there's something else that you want to tell us about the rules, that would be the prime opportunity to share that information with the department. And that's what I have. So I think if my co-presenters are good, I think we can open this up for a little Q&A time. I got thumbs up, and I think we're ready to go. So I think I don't know how we want to do this, if we want to let people come off mute or if we want people to put questions in the chat. I think either is probably okay. There's 117 people, so you can't all talk at once, but
I would say if you want to put your question in the chat, that would be great.
Okay.
Or if you also want to use the hand raise function on Zoom, feel free to do that, and then we'll recognize you and have you ask your question.
I'm glad we have a seasoned Zoom user helping us host this. So thank you, Angie.
No
I was
problem.
supposed to say we're all early childhood professionals. We're used to dealing with a lot of different voices going on at once. So I'm not monitoring the chat. So okay. It's a quiet bunch. Oh, we got a hand raised.
Go ahead, Gabrielle.
Sweet. Hello.
Hi.
Hi. I have one question. I'm not sure if this is the right place to ask the question, but for the teacher qualifications, lead teacher and just regular teacher, I'm not seeing anything about the two-year rule. I don't know if that's a licensing thing for role types or if we're finally getting rid of the 2-year rule to be a lead teacher.
Yeah, so we've done some rearranging of our qualifications on that. I'd have to go back. That's not my strongest suit as the staff qualifications. We will be giving. I should preface this whole section with, we'll be giving you my email address, and you can send those types of questions, and I'll make sure that the right person answers those.
Okay.
But in the big picture, yes, we're going to be. This rule package would make staffing easier. It would remove some of those qualifications that really during that childcare assessment period that we heard from providers that this wasn't the most helpful for them. We heard from families, and then finally we also checked that against federal rule and state rule to see how that would work. So yeah, staff qualifications are a bit different.
That would be so awesome. That would be life-changing. So whoever I need to email to tell them that, I will.
On our next slide here, we'll have contact. It'll be my email address.
Awesome. Yes. I have more questions, but I will just wait a second and let someone else, if someone else is raising their hand.
It does look like we have a couple questions in the chat too.
So I'm reading them here. I think I'll have to scroll up. I'll start with the first one. So how long before they're adopted and put into regulation? That's really the issue we're dealing with here, is that we have put them together, and they really need to be go through and be approved by the interim committee, or at least not objected to by them before we can enact them. There's a long process to this, and for good reason, right? You know, you don't just want state agencies to be able to enact rule willy-nilly. So there are checks and balances throughout. So we're right now in one of those checks and balances, and we have been for the last 2 years. So oh, and the county sanitation one too. That is one that we have heard. It's hard, you know, some counties don't have somebody who's readily available to do that sort of work. And I would say that's another good one to send to me. I'll say the other reason, other than I want to make sure I get my information correct, the other good reason to send me emails with your info and your questions on it is so that I can start to tally these things and say, hey, you know, we got a lot of people who really have a lot of questions about issue A or issue B. And then I can work with, you know, my supervisor, my team, to really address those appropriately. So it really does help us.
Jen Ruland, if you want to come off mute and ask your question.
Okay, so for the nutrition part of it, is there any way you and the food program can get on the same page?
That's a great question. And we are working now. So Brooke Pickett is our CACFP program manager, and our subsidy side, our licensing managers have started regular meetings with that program. There are some changes to this around food and nutrition, and we did try to line them up. Both the rule with CACFP, and then there's going to be some guidance documents too that will follow. I may be optimistic here when the rules finally are put in place that will help providers and help everybody really crosswalk those and figure those out. So it's yeah, we got rid of things like having a dietitian review menus and things like that. Things that were just, you know, were laborious and didn't necessarily lend itself to a better program necessarily.
Okay.
Thanks, Jen. Butte 4Cs, if you want to come off mute and ask your question.
Well, Butte's coming off. I finally got to the top of the question, so I think I'm handling this well now. Does the age change to 16 for working apply to family group? It does. It'll apply to all provider types. Marissa Shirkenny, I believe you're from Bozeman. I would love a review of the proposed changes. I've seen a summary mostly focused on immunizations and adult-child ratio. Can you share more about the proposed changes? That's a good question. And going back to the slide, so the nice thing is that this is recorded, so you will be able to access that earlier slide. And I will look. There is on that licensing page that I showed you some of the proposals in there. I'd have to go back and look. I don't think there's anything that actually does like a crosswalk on those rule changes, but you are hitting the big ones. Some of it's also around you know, not just licensing inspection, but you know, trying to align some of those other things like fire and sanitation inspections as well. Mute, are you coming off mute? Okay, I'm gonna keep going. Oh, I answered this one. So how long before they adopted after they're adopted, they put into actual regs? I'd have to look at the timeline, and if you really want to get into the weeds, the Secretary of State has a whole timeline about when something's adopted to when it actually becomes in effect. It is usually in part of that rule process about when they're enacted, but usually, you know, it's a couple months after that. And as far as grace periods, or that was about the sanitation, yeah, that would be a good one to send to me.
Can you hear us yet, Jody?
I can, but you're on
Oh.
mute still.
Weird. So I'm not. Are we? Yeah, it tells me I'm unmuted.
Okay, go for it.
All right, go ahead, Leanne.
Hi, Jody. My name is Leanne Butt, and I'm here in Butte at the Four Cs, and I have a group home childcare. And I was wondering in the regulations why it still has a separation between licensing for center and calls homes, families, and group registered. I mean, Jody, even my dog gets licensed. I think
Yeah,
it's
I'm gonna.
important that you don't separate it like that. It kind of gives us a status of less than.
So I will say from our perspective, on the HHS side, we use licensed and registered now as just kind of one thing. It came up during a, I don't want to get too in the weeds in this. It came up, and it was one of the objections in the initial filing of this, is that MCA only designates, so that's Montana Code Annotated, that's the law of Montana. And what we're trying to amend is the administrative rules. So MCA is on top, and then we build the administrative rules underneath that. And that's, so the legislature does the Montana Code Annotated, and then programs, the agencies do their rules, and how do we address those laws. So that was really in response to a legislator saying that the only programs that can be called licensed are those centers. I think it's a matter of semantics. I think that
I think it's an important one.
I would agree with you. And that was one of the concessions we made when we thought, if we make this, maybe we can get this through. It turned out that that wasn't the case. But I would say that's probably one that we really can't change, and would be worth talking to a legislator about, whoever represents your area.
You don't represent our area?
Not as a legislator, not I as much as I'd like to, I can't make law. I can try to come up with administrative rule, and but law is out of our purview. That's the legislative, we're in the executive branch.
No comment.
Susan, Zeke, if you want to go ahead and come off mute and ask your question.
Oh, hi. It did let me. I'm so sorry. So, I am here in Great Falls and been in childcare many years. Everyone probably knows that change is hard for everyone. And so I did kind of look at the survey just a little bit, and it's asking about, if these proposed rules were changed, how much money do you think it would cost you? How much do you think it would save you? Will the child care licensors work with us? Because there's 97 pages on the proposed rule changes. Will there be people in our area to help guide us and, be kind to us if we miss something? Is anyone there?
There we go. I got muted, and
Okay.
I had to cough, and then I had to ask to be unmuted. So I will say, so let me back up just a hair. It's not 97 pages of all new rule. Big pieces of this aren't really changing. We just restructured where they are in the rule. So I think that's important to know, that we're not every single thing you do is going to be brand new. The
Okay.
second thing is, absolutely. One of the things that we're working on right now, in hopes of this getting through at some point, are interpretive guides. So it really says, okay, here's the rule, and then here is what this means for the provider. And we're also doing, I'm getting a little ahead of myself here, but we're looking at things like tiered enforcement. So we've assigned risk levels to certain things. Obviously different sort of deficiencies, or different, I don't even think that's the right word. There's certain risks of not meeting certain rules that are greater than not meeting other rules, right? So we want to make sure that, as a provider, what's expected of you, and you also know, that's sort of what the department sees as the risk level for that particular rule. And yes, we will be working with, CCR&Rs, our licensors, our staff, will be equipped to answer those questions. And I also think there'll have to be for certain things, although I do think it's moving towards a more lenient and flexible model. If there is an area, where a provider wasn't aware of something, for example, that we can look at, flexibility and enforcement on that. So I hope that answers your question.
Thank you, Susan. Gabrielle, if you want to go ahead and go off mute and ask your question.
Sweet. Thank you for letting me off. I have a question. I have two, well, one actually. I'm just wondering about the substitute rule, and I don't know if that's for you guys or someone else. So as of right now, substitutes for centers do not have to be on the practitioner registry. And from what I was reading, now substitutes are going to be required to be on the practitioner registry. My only concern is to renew on there, you have to do 16 hours of annual training. And right now, our substitutes just have to do the orientations and CPR. Is
That's a good question.
Yeah, I'm hoping that it's just like a typo.
So no, it's not a typo. Really, the threshold is going to be 500 hours, service hours in a year.
Right.
If a particular person is working above those 500 hours, then they will have to follow practitioner registry and get those 16 hours. If they're below that 500 hours, then they don't have to do that. They would have to still, of course, do the required trainings,
Right.
but not those 16 hours of annual
Right. So that's still the same, but as of right now, substitutes do not have to be on the practitioner registry, but the new proposal from what I read says they have to be on the ECP, but they can't renew every year if they don't have classes, but substitutes aren't supposed to take classes.
I see what you're saying. Yeah,
Yeah.
and that's a change that we'll have to make, right, in our system to allow for that.
The ECP system?
Correct.
Oh, okay. See, that's what I was like, are they gonna fix that? I'm fine with having them on the registry. It's just those annual training,
Yeah,
trying to
no,
get
that's a
somebody who
great
works a day a
question.
month.
Yeah, no, and we've recently, talked about how that's going to work, and it'll take a little tweak to the system, but yeah, they'll be able to be on there without having to have those 16 hours. It's also worth noting that out of school time care, school age care, people who work in those programs will have 8 hours per year of ongoing training that they'll need. So yeah, we'll switch up the system so that it's flexible and meets
Awesome.
the needs of the folks who are working.
Okay, I have one more question, but I'll come back after someone else has a question.
Okay.
Thank you so much.
You can tell an early childhood person, they know how to share and take turns.
Thanks, Gabrielle. Allison, if you want to come off mute.
I put my question in the chat and it's just,
Okay.
sorry, hello. I think 97 pages makes my eyes go cross, and trying to keep track of what's new and what's old was difficult. Can we please have a revised version that highlights what the proposed new changes would be to set them aside from the original 35 pages, perhaps?
Sure. I can look and see what we already have, but I think that's a great idea. Kind of a quick overview of what's new. Excuse me. Yeah, I think that would be helpful. I think that's a smart idea. I don't have a timeline for that, but it's definitely something that I will present to my team.
Thank you, Allison. Marissa, if you want to come off mute and ask your question.
I would say, and I just saw something in the chat, 90, using the 97 page document, to inform the survey. You can take the survey, I think, with just making minor reference. You don't need to read that whole thing to take the survey, but that is good feedback.
And that's actually where my original question, and then what I was getting on here to say is exactly what Allison just said as well. I got on to take the survey, and then in the process of taking the survey, I realized there was a lot more in that rule package than I had realized based on kind of the summary pieces I had gotten before. And actually, I thought that's what this meeting was tonight, was to kind of go over some of what exactly those changes are, to isolate out what the changes are versus the entire rule package. So sounds like you're getting that feedback. So I guess I would extend that and say, can we get the summary of what the changes are prior to when the due date for this survey is going to be? Because I do think it would inform our knowledge of how impacted fiscally will be.
Well, I would say I don't know how feasible that is, to be honest. It's Wednesday and it's due on Monday. I would say that, you know, if you can't get to it, you can't get to it, or maybe you can answer a few, maybe around, you know, I think there's probably a few that maybe lend themselves to a quick analysis over others. Like I'm thinking of staffing changes. But yeah, hopefully we don't have to do this again, but if we do, I will take that under advisement.
Okay, well, yes, thank you. We'll do as best as we can in the survey, I guess, based on that.
Thank you. And I recognize it. This is really fast and furious. It's it's a quick turnaround.
Yeah, thank you.
Thank you, Marissa. Gabrielle, if you want to come off mute and ask your question.
Hello again. First of all, I wanted to tell you guys thank you so much for planning this and spending your Wednesday night answering our questions, because you guys don't have to do that, and I appreciate it so much. That's one thing. That's not a question. My other question is the ratios and the ages. Those are already set in stone. Is that right?
That's correct.
Okay.
So those came through in the 23 legislative session.
That's what I thought. I just wanted to double check on those 5-year-olds.
Yeah.
I think that's it.
Thanks, Gabrielle. Any other questions?
Angie, there might be a couple further up in the chat, but if we missed it, please feel free to raise your hand as well.
While we look for those questions, Jen, if you want to go ahead and come off mute and ask your question, we'll find the ones in the chat.
Okay, so back to the ratios and the ages thing. So why is it that centers get to have their infants at 18 months cut off, but family and group don't get to have theirs cut off until 2?
Great question. So this is something that came out of the legislative session, and it's something we're trying to align in the new rule package. But until we can do that, that's the law. So the particular law that came through, I believe it was House Bill 422, made those changes just to that type, and did not touch any others. So at the time we thought, oh, okay, we'll just fold that into our rules and make that uniform, because that makes more sense. It's easier on providers, it's easier on families, it's easier frankly on licensors too.
But your guys are trying to change that to make it so that we can cut off at 18 months for an infant?
Trying to align it. Yeah, I'd have to go back and look exactly what it is. We're trying to align it with what the centers are currently. So the centers were changed through the legislature, not by us, but we're trying to make that a uniform rule to make it make more sense.
Yeah, that makes sense. Okay, thank you.
Thanks, Jen. Some questions that have come in the chat, Jody, is I'm very curious why the push for accepting unvaccinated children. Have there been a lot of pushback from parents, and how does this compare to public school requirements?
I'm going to be very, very careful and cautious in talking about this one. This was really informed largely by legislative action. And that's really where that came from. There's a lot of different opinions on this, and I'm just gonna leave it at that. I will say though, if you want to write me, that's a great one to write me about. Not that I'm gonna give you probably an answer you're gonna love or frame or anything like that. But it'll be easier to address, and that I can point you to some various pieces of legislation and things like that.
Another question, Jody, is why is it centers can have higher ratios at lunch hours when group homes can't?
I gotta be honest, I'm not sure what that's in reference to.
So Lori, if you want to come off of mute to give us a little bit more context on that.
And that might also be a good one to write me to, so I can, I work with a lot of really smart people who know this information really, really well. And so those are the sort of questions I would like, if you could send that to me in an email, I can go to our licensing team and get a good response for you that adequately answers your question.
And it looks kind of the same sort of question came from Natasha Ward as well. For the rule for centers allowing staff to leave during lunch, they would be going over the ratio, but family group can't do that. So Natasha, so we will show Jody's email in the next slide. So if you would like to email him that question, we can get you an answer. Any other questions?
I think Jen, if you're able to click off mute, it's like you might have been talking.
I was talking to my daughter. I'm sorry.
It's okay. I did, there was one other question too, just what is the main objection? I did put the link to the objections in the chat, but I don't know if Jody, if you wanted to elaborate at all.
On the objections. Sorry, is that what you said? Yes. I can't type and listen. I just put my email in the chat. It'll be up at the end too, but we can put it in there a few times. Yeah, I would look at those objections. I don't want to necessarily be interpreting those on the fly here. So I'm sorry if I'm being a little cagey, but.
No problem, Jody. We did have one last question come in from Victoria. Does the school age change that allows for school age children to qualify for Best Beginning Scholarship extend to school age children in a licensed center as part of its school day program?
Yes, so that is really one of the big drivers, if I'm understanding this question correctly. That yeah, the idea is so that they can become licensed and open up their program so that they can access Best Beginnings scholarship for the kids in their program. And I guess as far as hours and stuff like that would be determined through the authorization process for that. But it wouldn't be just like special occasion kind of stuff. It would be, you know, regular care. Yeah, so if you had a school-age child, and I guess that's okay. I'm reading a little bit better here. If you had a school-age child in a licensed center, if it wasn't like a dedicated school-age program, then it would fall into your regular center programs, and you know, whatever the hours that child would attend, the authorization for that Best Beginnings would be built off of that. Get a little hoarse. Are the questions that Jody will be getting the answers for going to be available somewhere for everyone to see the answers? I think we can figure something out like that, like an FAQ kind of document that we could put up on the department page, on our bureau page. And that way, I'll say this. That way, if we're going to those lengths, you know, those are good answers. Like people have looked at those, not just me speaking extemporaneously.
I think that sounds good. We'll do one final call for questions and then we'll move to our next slide. Any final questions? Okay, perfect. If I did miss your question in the chat, please feel free to put it back in. I'm going to pass it over to Caitlin to kind of talk next steps.
Great, thank you. All right, so we have a few next steps that we've outlined. First and foremost is to please try, if you're able to, with the information you have, fill out the economic impact survey, and also encourage anyone else who maybe wasn't able to make this call to either listen to the recording or please share the link. And we'll maybe Angie, or you could pop that in the chat again. It's up a little bit further above, but we'll make sure that everyone has that information if you missed it earlier. And then again, please email Jody. We'll have, not on this slide, but on the next slide, his email again is also in the chat. So if you have any questions about the rule or anything in general about the work that he's doing, then please make sure you reach out. And then if you're interested in providing public comment next Tuesday to the Children and Families Interim Committee, or learning more about the legislative process in general, I know Angie and the team over at 0 to 5 Montana, we're more than happy to help answer any questions about that process and how to connect with your legislator. If you go to that link that Angie just put it in the chat about the interim committee, on the right-hand side, there's a button where you can submit public comment. And it's quite convenient. You can do it in writing, and that message will go out to all the committee members. So if you have any thoughts about what's being proposed in terms of the rule package or the objection, there's the draft objection. If you click over to meeting information, you can also scroll down and see a lot of different links, and you'll see in there a specific link to what is in the objection. But that's a great way for you to submit public comment. And then on Tuesday during the actual meeting, you can also call in. And so if you still click on that link around public comment, it will give you information about registering to provide that public comment. And then you can also go in person as well. But there are a few different options: writing in, calling in, being there in person. And you can always reach out to any of the folks who are on that committee at any point. Their emails are also listed on the mt.ledge website. And you can also reach out to your own legislator as well if you have any questions or concerns that you would like to make sure that they're understanding about the incredible work that you do for children and families and for the childcare workforce every day. So just want to make sure that you have opportunities for how to get information to the folks who need to hear it. And then you can also, there's a link for registering for that public comment here on the slide deck too. And then for any other ongoing updates about what's happening within the legislature around childcare, we just request that you go and subscribe to both the RAISE newsletter as well as to the 0 to 5 Montana newsletter, and we'll have more information for you. So with that, I will turn it over to Angie for the final slide.
Caitlin, did you want to go over your cost of care modeling tool?
Oh, I do. I'm also getting a message that I have a child that is a little hungry. So I will go over this very quickly. So we just wanted to let you guys know that a little announcement on the side, but there is a cost of care modeling tool webinar that's happening on March 13th. So next week on Wednesday, there's going to be another webinar, and we put a QR code there so you can just take a picture and have that information. And I'm actually going to turn it over to Rhonda really quickly. She can tell you a minute about it. So hold on one second.
And as we wait for Rhonda, I will go ahead and put those two links in the chat for the RAISE Montana newsletter and also for 0 to 5.
Right. Thanks, Angie. Hi, everyone. So next Wednesday, I think the 13th is Wednesday, from 1:30 to 2:30, we're sponsoring a webinar with our partners at prenatal to 5 fiscal strategies that created a new cost modeling tool for Montana. So those of you that are in STARS or have used that tool that is required in STARS as part of the budget. This is similar to that, but it's an expanded tool that is really helpful to use to figure out what your cost of care in your program is, all your expenses, your revenue, everything. And then you can also use it, you know, if you want to expand or add infants or whatever, changing age groups around, things like that. So we're launching the tool next week. We'll walk through a webinar with the people that created it. There's user guides that'll go with it. So you can register for it. It's an hour of ECP credit. And if you can't attend, the recording will be posted online, along with the tool and the user guides and everything, but definitely join us next week if you can.
Thanks, Rhonda. All right, and so just to wrap us up, our last slide, there is all of our contact information for Jody, myself, for Caitlin, and Alex for 0 to 5. If you have any questions, please feel free to reach out to any of us. And then also just a reminder that this session has been recorded, and so Raise Montana, and I'm sure 0 to 5 as well, will be putting a posting of this recording on our website. So if you would like to access it there, please do. And we really want to thank everybody for coming. If you want any of those links, make sure you grab them from the chat before you leave. And we wish you a really good night. Thank you for attending.